Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here from, as you can see, Studio B. And we are spending a little time today with Brian Peters, CEO of MHA, which is the Michigan Health and Hospital Association. And so right now we want to talk about not only welcoming you back, but you have some economic impact news for us that you have just recently released.
Well, thank you as always, Chris. It's a pleasure to be with you. And you're right. Despite the the challenges that the healthcare field and hospitals in particular have dealt with throughout the last couple of years, we remain the largest private sector employer in the state of Michigan. According to our data, some 572,000 Michiganders are directly employed in the healthcare field. The largest single component within healthcare are Michigan hospitals. And, that's true whether you're in our largest cities or in some of our smallest rural communities where the hospital is often one of the largest, if not the largest employer. And so I think as we think about long-term economic growth in the state, hospitals and healthcare have to be part of that conversation.
Well, it's tremendous stuff, and of course the majority of the demographic of population is moving towards they're going to need your services more, and
Right.
I'm sure that your statistics show that that's a growth industry for many years to come.
Well, that's absolutely true, and particularly in a state like Michigan, where there's something called the aging in place phenomenon, because unlike some other states that have an aging population, but it's offset by an influx of folks who are moving into the state from elsewhere in the country or immigration from other countries, we don't have that to nearly the same degree. And so our population is aging like the rest of the country with the baby boomers. And so when we look at the payer mix in our Michigan communities, it's trending more heavily towards Medicare, the public program for our aging population. And so you're exactly right. It is a growth sector, and that is the portion of our society that, as you said, requires more intense and extensive healthcare services. No question about it.
So, what are your members doing? And I'm sure that you're helping them in this direction. What are they doing to prepare for this?
Well, they're doing a number of things. You've probably seen around the state a number of construction cranes on hospital campuses or in new areas where there's going to be a new hospital or a new facility. And the reality is those are desperately needed for the reasons we just talked about. We look at demographics and know what the emerging need is, but you have to remember that the lion's share of our hospitals in Michigan were built using Hill-Burton money, many, many decades ago, at a time where we didn't have the same sort of focus on infection control, meaning these were non-private rooms. We had a very different approach back in those days. And today there's a demand for private rooms. There's a demand for spaces that can accommodate the latest emerging technologies. And in most cases, those older hospitals just couldn't do that.
All right, so let's talk about funding challenges, because that's got to be in the future, right? Let's dig a little deeper in the funding challenges situation.
Well, Chris, we had a MHA board retreat back in August, and far and away the number one priority of our board was financial viability. And that's driven by the fact that we have seen in this calendar year, all the way to we're nearly at the very end of the year, we have seen the worst financial performance from the vast majority of our members that we have seen in many, many years. It's a combination of factors. It's driven largely by the fact that everything costs more. Now, our supply chain costs have just exploded. In the typical Michigan hospital, the workforce cost is normally about 50 to 55% of total cost. And so when you have the cost of staff, particularly in the nursing area where we are using contract labor, which is extraordinarily expensive, that is going to make an untenable position if we can't get those costs under control. And that's been incredibly difficult to do. And so, we have this phenomenon that has really pressured our hospitals. And at the end of the day, we need to do everything we can to maintain access to the community. And we can't do that if we continue to bleed red ink. So we're asking Congress, we're asking our state elected officials to do everything they possibly can to shore up this situation while we make the needed innovations and changes. This is not just putting money into the same old system. I can tell you we are modernizing our approach in many ways.
Well, and so you have to. Let's talk on very quickly here. We've got about a minute. Tell me about the talent pool, which is a challenge everywhere, but in particular in your industry.
Well, you're exactly right. Healthcare employees tend to be very highly educated, whether you're talking about doctors, nurses, respiratory therapists, PAs, pharmacists, the list goes on. And we are in desperate need of just about every one of those and then some. And not only in our big cities, but in our rural hospitals and in rural communities as well. And so we've been working with the higher education community, community colleges and the four-year universities to create new opportunities to embrace that pipeline and really shore up that pipeline into the future. Unfortunately, this is not a situation that's going to be resolved overnight. We understand this is a long-term situation and we're treating it as such.
Well, I think immigration reform has to be part of this in the future. Brian Peters, CEO of MHA, the Michigan Health and Hospital Association. Thanks so much for joining us. We appreciate it. And we'll bother you periodically because we need updates on this industry.
Thank you so much, Chris. I appreciate it. All the best.
Always good to have you on. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman. We'll be back with more.